Welcome everyone to today's webinar. I'm Megan Wood with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. It is now my pleasure to start today's webinar by introducing our speakers. Taylor Foss serves as Senior Vice President of Organizational Transformation of Mission Health System, Inc. A leader in human resources, Taylor brings a rich background and proven record of helping organizations implement top programs to ensure their people thrive. Today, Taylor is joining us to share about her latest work at Mission Health. Now a widely recognized human resource thought leader, Amy Leschke-Kahl began her career as a chemical engineer. While her science background and people-focused work may seem like polar opposites, both focus on her strength, solving really hard problems that you can't see. As Vice President of Performance Acceleration at the Marcus Buckingham Company, Amy collaborates with clients to transform performance and leadership development across the globe. Amy uses her first-hand experience to customize her approach to the unique culture of each company. She then utilizes proven techniques for measuring engagement and performance and works with clients to design integrated sustainable solutions. Amy holds a chemical engineering degree from Miami University in Ohio and an MBA from the University of Wisconsin-Milwaukee. At this time, I am pleased to turn the floor over to Taylor to begin today's presentation.
Thank you so much, and I want to say first of all that it's a privilege to be with all of you today, and hopefully we'll have plenty of time to answer your questions at the end of this, because that's where the richness really comes in. I wanted to start out by just describing a little bit about Mission Health and giving you a little bit of history. Our CEO, Dr. Ron Paulus, came in 2010, and his focus has been, since he got here, was on improving the quality of healthcare for all of our community. We have 879,000 folks in Western North Carolina. The main hospital, in Asheville, is Mission Hospital. We also have 5 regional hospitals. We have a post-acute care facility called Care Partners, and we have Asheville Specialty Hospital. We have $1.6 billion in revenue, and we've been a top 15 proven healthcare system 5 out of the last 6 years, which really means that 500 more lives get saved in our hospital than the national average, which has been going on since 2015. We have 12,000 employees. We call our employees team members in Mission Health. I came on board in about 2011, at the end of 2011, and my job was to transform the HR team from a pair of hands to strategic business partners with centers of excellence. And we did what I think many of you would do, which is we created a great place to work and practice strategy. We created advisory councils. We introduced a great deal of leadership assessment and development programs. We created a new communication plan. We streamlined all of our policies and procedures and standardized them. And we put in a brand new recognition program, which was user-friendly and fun for all. All of those things were good things. We also did a number of other things. But if you look at where our employee satisfaction and engagement went, it stayed flat. And this particular chart exemplifies that. From 2009 all the way through 2015, you can see that whether it was commitment, organization, manager, or employee, everything stayed level. So even though our quality scores were going up and our patient sat was going up and everything was going up, our employee engagement was not. So my CEO finally said in 2015, I don't know how we can justify putting in more and more programs and all of this if it's not a return on investment. We don't seem to be doing the right things, and we're doing a lot of good things, but they don't seem to be taking. So I quickly, as most of you would, stopped some of what I was doing and really focused on researching best practices out there. What was out there that would help us really move the dial on this? When we talked to our team members, they were tired. They were really burned out because we had put so many things in place to focus on the quality and safety of our patients. And they just kept feeling like it was more and more, better, better, faster, faster. And we weren't focusing on them. So we really wanted to increase engagement. We wanted to bring joy back. We wanted to create a conversation culture where there was more two-way dialogue. We wanted to improve retention. We wanted to take steps to eliminate things like big annual performance reviews, which everyone hated. And we really wanted more information on an ongoing basis about what the engagement was of our folks and what their concerns were. So in doing my research, I came upon Marcus Buckingham's work, and I've known Marcus Buckingham for a long time. I think most of us have gone to conferences where Marcus has talked, and his message always resonated with me. He's really strengths-based, but this new endeavor of his backed up all the things that he believed in with strong data. And in our organization, data matters. I couldn't just go to the CEO and say, hey, I have this great idea. I had to really investigate and be sure that whatever I presented was evidence-based. And so I'm going to now turn this over to Amy to share much more about the research that the Marcus Buckingham Company has done, and then I'll return to tell you what we did with that. Amy?
Thanks so much, Taylor. So what I'm going to do is really just kind of lay the groundwork for the work that Taylor and Dr. Paulus and their teams have done at Mission Health and kind of what got them started and, quite frankly, what got us started as well. Like Mission Health, and probably like all of you, there are some talent must-haves, things that we absolutely have to do as talent practitioners and talent stewards. First, of course, is talent acquisition. No surprise, we have to get the best people in the door. Once they're there, we need to know where they sit, how much they get paid, what their benefits elections are. And those things are wonderful and great. And quite frankly, we've done them quite well as a practice, as a talent practice. And to Taylor's comments about their flat engagement, all of those things that we have done in those two buckets have left a big gaping void for all of our organizations. And that is, how do you turn that talent on? How do you take that talent and really help people do more of their own unique best work? We at TNBC call that talent activation. And while we've tried all of these things, they haven't worked. We've done things, and we've all done this. I've done this as a practitioner myself as well. We've really tried those one-size-fits-all development approaches, big, complicated programs. We've been looking to the past and focused on the past. In fact, we've been making a lot of our decisions based on data, not only that is poor data, but also incredibly infrequent and incredibly old. As Taylor kind of alluded to, a lot of our performance review systems, they're conventional, no one likes them, they're arduous, and they've got bad data, which then oftentimes leads into these compensation rewards programs where no one really cares if they get a 2.75% increase or a 2.8. And yet we put a lot of time and effort into trying to differentiate by those little teeny tiny bits. So what we did at TNBC is really took a deep dive and almost started over to look at why are those things not working? And there are so many fundamental flaws with our conventional approaches. So when you think about what we've done, we've always had this moniker, this cliche, if you will, that says what's measured gets done. The reality, however, is very different. What's measured gets measured. So when we pull the measurement out of the activation, when we separate those two things, when we create distinction between measurement and activation, all of a sudden we start to get clarity when we treat those differently. So I'm going to talk a little bit about measurement and a little bit about the activation. So when it comes to measurement, there's one thing that has created a fundamental flaw in measurement. Now, there's lots of them, but perhaps the most surprising and the most impactful is this. It's this thing called the idiosyncratic rater effect. What the idiosyncratic rater effect tells us is that when I am rating someone else, that rating is more about me than it is them. In fact, the research shows that 61% of my rating of someone else is more about me than it is them. Now, in addition to all the other biases that are presented because we're human beings, as well as oftentimes, quite frankly, not even measuring the right things, we've created this plethora of really bad, infrequent, past-looking data. So Taylor may speak a little bit about this in a little bit, but know that when we are making decisions, differential decisions about our talent, including compensation and who's a hypo and maybe who we promote, we've been making those decisions based on bad data. When we think about the activation part of the equation, we've also not been doing the greatest job on that either, per Taylor's little, her graph, her slide where we've seen flat engagement. So the question around activating our talent, helping them do more of their own unique best work is how, in fact, do we do that? And how do we do that in the real world? Now, I've tried this as well. We've tried to have these complicated models and we've tried complicated programs, and yet we haven't accomplished what we set out to do, which is how do we flip the switch on our talent? Well, there's bad news and good news. The bad news is that to activate our talent, there's no magic model. I mean, we've tried, right? We've tried to identify this perfect leader model, or we've tried to identify the perfect frontline worker model, and there actually doesn't exist. You all know this data. You all know the power of the team leader. And when we look at the Gallup research, which is tremendous research, when we look at Gallup says that 70% of employee engagement is due to the team leader. And engagement, that's really, if we're going to pay attention to anything, pay attention to engagement. By the way, we define engagement as the emotional precursor to performance. What are the conditions necessary for people to do more of their own unique best work? And no surprise, most of that, the person who has the power and the influence over each of your employees is the direct team leader. So if there's no model, and we know that team leaders really are the pivot point to great performance and, quite frankly, high engagement, what do? Well, there is one thing that the research has told us. The one thing that the research has told us is that there are three things that the best leaders do, or the best leaders know, rather. So the best leaders, they know the strengths of their people. They know where each of their employees' best work lies. If a team leader, if a manager's most important job responsibility is to help their team members do more of their own unique best work, then they need to know where that unique best work is. And the best team leaders know this intuitively. The rest of us, not so much. They also understand what the most important work is that those team members have to get done. Now, again, you may think, I used to, that, oh, of course managers know what their team members need to be working on and what their most important work is. But the reality is most of us are working managers. And quite frankly, we have our own important work to do and our own fire drills to fight. So team leaders oftentimes actually don't know where their team members' most important work is. And finally, the best team leaders know how their team members are feeling. They can kind of have that sixth sense, if you will, about is someone really loving the work that they do, or they're having a difficult week, what's on their mind. They know what's going on inside of the head of their team members. So those are the three things that the best team leaders know. And the best team leaders also do one thing, not 10 things, they do one thing. And that one thing is this. The best team leaders have really frequent conversations with their team members about near-term future work through a strengths-based lens. And we've often heard, feedback is all around in the marketplace. Everybody's talking about feedback. And really, we need to be talking more about coaching. Not that feedback, we never do that, but we need to really be focusing on people's best work. How do we help people do more of their own unique best work? And the data is incredibly super clear about this, that when team leaders and team members have weekly conversations with each other around their near-term future work, their most important work, that the percent of employees who are fully engaged goes up. And not just a little bit, it goes up dramatically. Of course, that all sounds great and it looks wonderful in a PowerPoint presentation. And the challenge that we all face is how do you turn that into the real world of work? How do you make this come to reality, and particularly in the difficult world of healthcare? So I'm going to turn it back over to Taylor right now to share what Mission Health has done to turn this into the real world.
Thank you, Amy. So let's start with what we're all facing right now, and that's healthcare chaos. You know, and I know that the headwinds are going to continue. I don't know about your executive team, but ours spends a lot of time on talking about how to mitigate those headwinds, a lot about cost cutting, a lot about growth, whatever we can do to survive. And what you need is, of course, resiliency and adaptability and innovation, all just to be sustainable. And so, as my mother would say, healthcare is not for sissies. It's a tough business. So let's go back to where I was in 2015. As you know, I discovered the Marcus Buckingham Company and their strengths-based technology called Standout. And it was based on compelling data that Amy just shared. So I was confident that I could successfully present an evidence-based approach to Dr. Paulus, which I did, and he was very intrigued. In addition, the Marcus Buckingham Company has done a number of white papers, and those white papers were also useful in providing information to Dr. Paulus to make a decision. Because he was intrigued, I suggested that we go and have a meeting and spend an afternoon with Marcus Buckingham and his team, including Amy, and we had the opportunity to do that. And by the end of that day, I can tell you that we just didn't have a conversation. We developed a partnership, and that partnership has continued to strengthen and grow. So the CEO was fully engaged, and we came back and said, we ought to do this. Next, we had to convince the rest of the executive team. And that really wasn't a very difficult sell, not just because the CEO was promoting it, but because once they saw it, they all knew that this might actually help us and that we could get more engagement from our folks. Once they approved it, I went to the HR team. Now, I don't know about your HR team. I'd like to say my HR team is very innovative, but I was talking about something that was quite outside their comfort zone. I had people dedicated to things like those big employee surveys and reviewing those performance management processes and working with our leaders on that. I had a group dedicated to these leadership assessments and development programs. So I had to really get them all excited about something that we hadn't talked about yet. I was very fortunate that it resonated for them. And we actually put our heads together and developed an implementation plan. And that plan included a short-term pilot with 1,000 team members. Those team members included non-clinical as well as clinical folks. It included IT, which was a very important part of this process, and I'm going to get back to that later. And it included a standalone regional hospital, which was about 400 people. So we had a really nice mix. All of the executive team was included, and a lot of our other support services functions. We established our baseline metrics, and we certified 7 internal team member leaders as leader facilitators. And those team members and team leaders were instrumental in how we moved forward. After 2 months of the pilot, we stopped and we addressed what went well, what didn't go well, and whether or not we really wanted to go forward. And we did want to go forward. So the pilot was done in May, in June, and then we decided this is a go. So on September 3rd, we went out there and started training 900 leaders at all levels of our organization. And we finished that training in November of 2015. So we took about 3 months to get all of that training done, but that was pretty fast because each training took 8 hours. Since then, we've incorporated the standout training as part of our new leader and newly promoted leader training. We've also used it during general orientation. The team members get a wonderful overview, and we provide team leader training right after orientation for standout. So standouts become part of what we do. Once we got through that, we realized that we also had to continue to support some of the team leaders more than others. So we've developed some ongoing processes that help us go out there into the field, so to speak, and work directly with team leaders to address any concerns that they might have. What you need to know is this is about accelerating performance, not compliance. We never say the word mandatory. We don't tell people they must do this. We know that that won't work. We give them the data that lets them know that if you really want to be an exceptional team leader and have an exceptional team, here are the tools you need to use. So that's what we did to start. And we started seeing improvement immediately. But I want to just pause for a minute and talk about where we shifted, what we shifted from and where we went to. So let's start with just this whole idea of traditional leadership and professional employee development. That's something that we're all involved in, and we certainly continue to focus on it. But what we loved about this new approach is that we had very simple research-based tools for team leaders. On the Standout platform, they can access pretty much everything they need. And it's been a wonderful change for those folks who in the past had to go through several days of leadership development. And the Standout, and I'm going to just go into a little more detail about what actually happens in a check-in and what the process is, because I think it'll make it clearer for all of you. The process is a team leader goes through the 8-hour training. The team leader then creates teams right on the platform. This makes it so flexible because oftentimes teams change over the period of a year. You can also be on more than one team, which is lovely for a matrixed organization like ours. The team leader invites those team members to join the team. Then the team member immediately takes the strengths assessment and identifies his or her top 2 strengths. Once they've done that, the team leader and the team members sit down and go over the assessment report. This is part of Know Me. Now the team leader really gets to understand what the team member is all about. Then the team member every week, and we usually do this on Fridays, but we're a little flexible given that people have different schedules. But the team member completes a check-in. And the check-in is very simple. It's rate yourself on a scale of 1 to 5. How much were you able to work in your strengths last week? And how much value did you create? 2 questions. Then, what did you love about your week? What did you loathe about your week? And what are your priorities for next week? And finally, and maybe this is the most important question, what do you need from me, your team leader, next week? So I, as a team leader, know immediately what I need to do to help my team member be successful next week. The team leader reviews that usually on Monday or Tuesday of the following week, can see all of it very clearly, and then takes that information and has a conversation with the team member. If they're in different cities, and some of our folks are, or different buildings and they can't connect that week, you can make comments right on this check-in, which allows that team member to know that that team leader paid attention to me. That team leader responded to me. So we're on the same page about what needs to be done. And we know for a fact that the more that engagement happens every week, the stronger the scores are for fully engaged individuals. So the team leader and team member connection is critical, and all of us want attention, and that's what this is all about. The next one is the 100-item annual employee survey. As I said, I had people whose full responsibility was pretty much doing that, but we went to an 8-item quarterly engagement pulse, and we're going to talk about that a little bit later. The one important thing I want to say about the engagement pulse is we ask everyone to do it quarterly, but a team leader can do it whenever he or she wants. So if they're feeling like, oh, people seem a little, upset this week, they can launch a engagement pulse and find out, in fact, if that's true. So it's a really nice way for the team leader to stay on top of how folks are feeling. And for feedback and performance reviews, we know we're always trying to fix weaknesses. This one is really coaching to accelerate performance focused on strengths. My goal here and what I'm all about is to create an environment where everybody can be their very best. If people can work in their strengths and leverage their strengths, they have so much more joy every day in their work. So we got rid of those conventional annual reviews. And I will tell you that every time I announced it, people stood up and cheered. It was remarkable. We knew they didn't like them, but we didn't know how much they didn't like them. And instead, we're doing a quarterly 6-item performance pulse and talent conversation 3 times a year. The performance pulse we do quarterly, the talent conversation we do 3 times a year. And that conversation is initiated by the team member, and that team member sits down with the team leader and summarizes and highlights the things that they're most proud of over the last 4 months, the challenges they had over the last 4 months. It's just a more in-depth conversation than the weekly check-in. But people believe that that's a very strong component of our strengths-based culture. And lastly, we got rid of the conventional variable merit increases that we had been doing. As Amy mentioned, if you got a score of 2.75 versus 2.95, you might get a different kind of increase. God knows why, but that's what we did. And we've gone to on-track increases for most, and we have something called Extraordinary Performance Awards for those folks who are identified by their team leaders. And that's a whole process that we go through, and people have really enjoyed doing that. So that gives you a little idea of what we do here to just make things work. And maybe most importantly, we had to become a truly great place to work and practice is one of our strategic priorities. We have 5 strategic priorities. But going to a strengths-based culture and changing and transforming our entire organization meant that we needed to elevate this to our #1 strategic priority. People all over the system talk about the great place to work and practice strategy, and they talk about strengths-based. It's just part of our DNA now. So what went well? Let's talk just for a minute about some of the things that we think went well. The pilot group created positive buzz, that's for sure. It really helps to have these informal champions throughout the system. And that helped us, I think, accelerate getting this into every organization. Announcing the end of the annual performance reviews was a big win. The CEO and his team are all in. And most importantly, engagement finally moved. I want to take just a little deeper dive on the engagement pulse so you know what I'm talking about. There are 8 questions, and the first 2 sets of questions, #1 and #2, really measure your team's sense of purpose. Items 3 and 4 highlight team members' need to understand excellence. Items 5 and 6 reveal how valued and supported your team members feel. And the last 2 items address the team members' feeling of certainty in the future. So 8 quick questions, and it takes people not very long to do, and you can launch it anytime you want, but as I said, quarterly is important. So let's look at the result. We started with a baseline of 17.5% fully engaged. That was below the US benchmark. As you can see, quarter by quarter, we increased it all the way to 39% the first quarter of 2017. I can't tell you how excited I was. I mean, it was just joyful around here, and still continues to be, because as you can see, we've maintained it, although we dipped the first and second quarter of 2017. I was at first a little bit worried about that, thinking, oh my God, this, isn't going to be sustainable. But we had a chance to look a little deeper into the data around that. And when we looked into the data, we looked at the we questions, which are questions 1, 3, 5, and 7, versus the me questions, which are 2, 4, 6, 8. We had been out there, and I'm sure you're doing the same thing, sharing with all of our team members about the headwinds that are facing us, what it's like in Washington, D.C., what's going on at the state level here in North Carolina, Obamacare, all of it. And they were getting a pretty good picture that things weren't rosy. If we looked at our detail under the we, where we fell down was primarily in those areas that were focused on confidence in my company's future, because they knew that it was a little scary out there. But what was wonderful, if you looked at the me categories, is that we were able to keep up those high scores for the me, which was really, really good to know, and gave us much comfort that folks were hearing us when we were saying it's tough out there right now. We need everybody to row with us, as well as the importance of that team leader focusing on that individual team member to keep them as positive as possible during this kind of environment that we're all in. So we've been absolutely excited that things are still very high on that me category. And if you look, we actually went up the last quarter on the previous chart. So we use these tools as though they were part of anything else that we do in this organization. It is incorporated in a number of our other programs now. And we have folks who come to us saying, my strengths are not what I'm doing today, and I really need to find something different within Mission that will allow me to leverage my strengths more effectively. And we work with them and do that. So it's been just a wonderful thing. So let's just talk and end with some of our lessons learned. First of all, technology can be a challenge. That IT partnership is very, very important. And one of the things that I've been very grateful for is that our Chief Information Officer early on connected with Amy and talked through all of the theory behind this strengths-based approach and all the research, but also some of his own concerns. So we addressed those right away, and he was truly all in. And when we've had technology issues, because we have some of those regional members in particular may not all have the kind of computer systems that some of the rest of us have, they were right there. They were Johnny on the spot, and they helped us in so many ways to get through that, so that would not be a barrier. And if we have a barrier, we can call the Marcus Buckingham Company, and they've been great partners in addressing those things. At elbow support is key. You have to meet the teams where they are. As many of you are probably wondering, yes, we have folks who had 40 people reporting to them, and that just wasn't doable. So knowing that, we created informal team leaders who actually got some additional development as a result of this, but then were able to have their own teams and report up to their manager, and that worked very effectively, particularly in our nursing areas. And nursing, by the way, was a critical part of our pilot group, so they were very helpful as we went through the rest of the system. And if you're wondering about physicians, I'll just make a note on that. We have over 500 employed physicians. We did not include them in the original rollout. We are including them now. We've done some pilots, and we're including them now because they really want to be a part of this. So more and more physicians are now on the platform. Our biggest issue was they don't think they report to anybody, so we had to work with that. And we have worked with that and have identified who can be the team leader for some of those groups. We also have incorporated Standout as part of our Physician Leadership Fellowship. So everyone who goes through that program is part of Standout. One of the things that we didn't do that we've now done since is, if I could do it again, I would have started with team member education about the importance of a strengths-based culture. Some of our team leaders did a very effective job after their training in translating that to their team members, and some did not. So we have had to come back around and help a few of those teams understand why we're doing this and why it's so important, and what they need to do to support it. So that's been a learning. We also are continually providing ongoing workshops and training. I have a very small employee engagement team. It's made up of 3 folks, but they spend a great deal of their time. In fact, one of the folks only wears his Standout t-shirt. He has several, but he wears his Standout t-shirt every day. I've never seen him in anything else. And he goes all over the system to provide ongoing support and training. And we do workshops based on the needs of those teams. I also will say that you can't wait till there's a slow time, that this really works during times of change and challenges, because you're staying on top of the issues of your team members. And as Amy mentioned, how important that was. So we really can't wait till there's calm, because there's no calm in healthcare. And this has really been a very helpful process for us to learn more about what everyone's feeling and how they're feeling, and dealing with it in the moment as opposed to waiting. There's much more I'm sure you have questions about, and I'm going to stop there so that we can certainly answer those questions. Thank you.
Thank you, Amy and Taylor, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. So we have received a ton of great questions. The first one is, what were the baseline metrics that you established?
We based it on the, yeah, go ahead.
One of the first things that we did when we started implementing this at Mission was to do that baseline engagement survey, and we did a stratified random sample across their entire system using those 8 engagement pulse questions.
Great, thank you for clarifying that. The next question an audience member has is, how do you measure organizational engagement if you switch to quarterly? We have annual organizational goals.
Our goals are very important to us, and we do update those goals every quarter. So it does sync for us. We know that we're on the way to the annual goal, but the engagement part, you're really finding out if people are stumbling, if they're behind, those are kinds of things you're looking for. If they start to fall down in their engagement or feel like nobody's supporting them, you need to talk to your team about that. That's critical. So I think it's an easy fix to try to make sure everything is syncing up.
The other thing I would say to that, Taylor, is that you all have done such a phenomenal job, and I'll say kind of reached a point of maturity in the organization where engagement has now moved from being a target to being a tool. And you saw that in your quarter by quarter numbers when it dipped down. Nobody panicked. Everybody said, oh, this seems right because this is what's going on in the organization. So if we think about engagement doesn't happen once a year. Engagement happens all the time, and quarterly seems like a pretty good cadence to look at it and aggregate it. But Taylor told you all about how team leaders can launch that engagement pulse anytime, and they get their results back immediately, because that's really where it happens. So putting the tools and the data in the hands of where that work happens, where engagement happens, that's with team leaders, I think is also a critical success factor.
And I also think, Amy, that you don't want to have this be punishment. So that's what we do with it is we want our team leaders to send this out if they're feeling like things aren't going so well, as well as when things are going well. So that's their tool, so they can address it immediately. And I have been in organizations where people are categorized as a tier 1, tier 2, tier 3 kind of manager. And so you were almost like you didn't even want to see your results. Here, you want to see your results. So we really want to keep it as much a team leader issue as anything else.
Taylor, can you speak
Excellent.
just a minute to the transparency issue about who gets to see the engagement data? Because that's a major switch from how I think we're all used to looking at it.
Yeah, this is for the team leader. We do aggregate for the whole organization, and we've been aggregating it for like the regional hospitals because they keep tabs on, are we going up or down? But they don't have the individual leaders' data. So that's up to the team leader. But yes, I have been, in the past, it was, we all knew everybody's scores, and it was very difficult conversations sometimes when one leader was falling behind others.
Excellent. Thank you both for your insight there. The next question is, how did you deal with the body of work that no one wanted to do and wasn't anyone's particular strength?
I love this question because it gets asked a lot, and it's true. There's always things that we don't like to do. And we always assume because we don't like to do it, nobody else likes to do it. What we have discovered is if you really have a transparent conversation with your team, there are people who really love the things you don't really love and are very willing to take them on. In fact, we've had many, many instances of that here at Mission. But do I think every day everybody gets to do everything they love? No. There will be some things that you just have to do. That doesn't mean, though, that you can't have the majority of your work in that strength-based arena. So I would say, number one, ask others, would you like to do it? And you can redesign jobs. Sometimes we just get in our own way, and we have to let go of those job descriptions and all those other crazy things and say, what would we do if we could start from scratch and just base it on who loves what? And you might be surprised. And oftentimes it provides some career enhancement to others.
That's a great point. Thank you. The next question is, how does your organization define quote, fully engaged?
This is Amy, and I can take that. Yeah, I can take that one. From a kind of everyday definition, I usually say fully engaged means all in. And when you look at the data, it's really clear how you measure that all in. Those 8 engagement pulse items that Taylor showed you, those are very based and steeped in research. In other words, what are those things that differentiate the very, very best teams from the very, very not so best teams? And that's where those 8 items came from. And one of the interesting things that we found when we did that research is that usually when we look at engagement, we're looking at a percent favorable. That is the average of the 4s and the 5s. But it's kind of funny, 4s actually behave a little more like 3s than they do 5s. So if we want to measure the all-in, which is where it all happens, that's where extraordinary performance happens, you need to look at top box. You need to look at the 5s. So when we measure percent fully engaged, for all intents and purposes, it's team members who have responded 5 out of 5 on those 8 items.
That's really helpful to understand. Thank you. This audience member asks, are you using an external organization for your employee engagement survey? If not, how are you benchmarking? Also, can you say more about eliminating annual appraisals and details about what is being used to replace performance conversations?
So Amy, if you take the first one, part of that, I'll take the second.
Yeah, Mission Health no longer uses any external engagement surveys other than the Engagement Pulse, which comes with the standout technology that Mission uses to sustain and continue to support their team leaders as well as team members doing more of their own unique best work. So it's inherent in the approach. Team leaders launch it anytime they want. Team leaders get the data back. And then Taylor and Dr. Paulus and the leadership team at Mission Health can aggregate that data anytime and look at general trends across the organization.
And for the second part, we use the Performance Pulse. And the Performance Pulse are 6 questions, and we do that every quarter. The 6 questions are, I always go to John when I need extraordinary results. I choose to work with John as much as I possibly can. I would promote John today if I could. I think John has a performance problem that I need to address immediately. I believe John has a unique set that would be very difficult to replace. And I think John is at high risk for leaving the organization. And that's done every quarter. That is not shared with the team member. That is something for the team leader to use as just their own personal documentation. There's places there where they can make notations and so forth. In addition, and by the way, remember that we have the weekly check-in, so we're getting data all the time just on how things are going from a work standpoint. So you know if they're struggling with a particular project or they're right on the money. We have the talent conversations, which we find very useful. I described that a little bit. There's a few questions that the team member fills out, sits down with the team leader, normally during their normal one-on-one. It's done every 4 months, and it gives people a chance to review the last 4 months. That is signed and put into that team member's file. So there's a chance for comments from the team leader on that, but it's very much based on the work that's been done the last 4 months, as well as future projects going forward. They actually discuss what kinds of projects would you be interested in working on. And if it's not project-based, it could be just how you're doing on your day-to-day work. But there's more conversation during that talent conversation period.
Taylor, this
Thank
is
you both.
Sadie. I was just going to say, I think a lot of people really struggle and wonder and are probably incredibly skeptical about the fact that team leaders don't share that performance data with team members anymore. Can you just maybe speak to like how in the world did that happen and what does that feel like to team members? How do they know where they stand?
Or the performance pulse?
Yeah.
I mean, that we're not sharing it. Well, they have these conversations during the talent conversations. There's an opportunity there to talk about anything that they're struggling with and where they're at. It's more like a parent-to-parent conversation than what used to be a parent-to-child conversation. The coaching is done on a weekly basis, but it's also done again at the talent conversation. There's really an openness here now to get that kind of coaching. People want it. I am inundated with folks who just want to spend time with me to coach them. So everyone is feeling that because folks want it, they crave it. And I always say it's like at a soccer game when your kid hits the ball the wrong way. You don't wait for a year to tell them, you know, if you used your left foot, you could have gotten the goal. You tell them in the moment, and that's what people want. They want that coaching so they can accelerate their own performance. So this part really, the performance pulse is just really for me as a team leader to think through, it doesn't take long, how I really feel and what I think about my own team members. So it's more for me than it is for anything else. Did I answer
Thank
that?
you both. Okay, the next audience member's question is, was there a particular questionnaire you participated in to help determine what each employee's strengths were?
There is. Yeah, there's a strengths assessment that the Marcus Buckingham organization has put together, and each team member does that when they're invited to the team. It doesn't take that long. It is time-based, and folks get very excited to see their results, and they're always surprised how much it resonates with them.
Thank you for that insight. The next question is, has Mission Health been able to quantify a true ROI for the increase in employee engagement?
Where, you know, everyone always wants an ROI, but the place where we really saw it was in our retention numbers. We had a goal of reducing first-year turnover or improve first-year retention by 1%. That doesn't sound like a lot, but in this environment, it's been very tough for us. We're seeing our first-year retention go down. It really needs to go up. We believe that, and again, other things are always in play here, but we believe Standout was instrumental. We improved it by 6.4%. Not 1%. And I think most of you can calculate what the turnover expenses are. So we were delighted to be able to share that with the board as well as our executive team.
Great. And this question is for Taylor. How do you deal with past leaders who are still around and want things done their own way?
Oh, we don't have any of those, no, of course. You know, a lot of this has been it isn't me that's making them do it. They see the benefit as teams are getting more engaged and excited, and there's just a real difference here. So if you're one of those leaders that hasn't gotten on board, you're going to kind of stand out in a bad way. So they get a lot of pressure from their other cohorts. In fact, I've been at leadership lunches. We do those fairly regularly with random team members and team leaders. And I remember one where somebody was complaining. They said, I don't know why we have to do this, and I don't see the benefit. And before I could open my mouth, 3 other team leaders jumped in and said, are you kidding me? This is the best thing that we've ever had. And so they did their own, convincing of this one person who didn't want to do this, and that person changed their mind. So they're getting more pressure from their peers than they are from anyone, because folks really see the difference it's making.
And during these changes, did you have staff that did not want to join in on fostering engagement? And if so, how did the organization handle it?
I'm sure we have had staff that didn't want to do that. But those folks probably don't stay here that long, because, we feel like the best thing we can do for our team members is create that environment where everyone can be their very best. And here we have given them a wonderful playbook to do that. So if they don't want to do that, then they probably don't want to be here. Believe it or not, we've actually had some team leaders come to us and say, I'm now realizing I shouldn't be a team leader. This is not what I want to do, and this isn't in my strengths. So we have had those conversations with some of our team leaders who just didn't want to do it. Few and far between, I will say, but still, there's always some.
Great, that's helpful to understand. Thank you. Another audience member would like to know what your response rate is for the quarterly surveys.
Do you want to talk about that, Amy?
Yeah, it really varies from quarter to quarter, and honestly, it varies from team to team as well. So it's dependent upon the team leader, quite frankly, and team members and what's going on in their world.
We've been very fortunate to have excellent participation thus far, but Amy's right. You could have a particular group that is just, we're going through surge now with the flu, so they may not have gotten to it. So that could be.
One of the things that the stat I do know off the top of my head is how often are team leaders and team members actually doing this check-in thing? How often are they actually having those conversations? And especially given the complexity of healthcare, it's actually remarkable. We know from our data that 92% of Mission Health team leaders and team members are having conversations at least every other week.
Excellent. Thank you both for those responses. The next question is, what impact did you notice that this had on patient satisfaction scores?
We haven't correlated that. Our patient sat's been high all along. We're always way up there. And as I said, the irony was that our employee sat wasn't as high, so we couldn't figure out that. But now we've gotten both of them high, so we didn't really have a lot of need. Well, it's always a need to have good patient sat, but our patient sat data has remained very high, but it was high to begin with.
And it looks like we have time for one more question. This audience member wants to know, you referenced team leaders, which I don't think is a specific title, rather than the person leading a team. Can you speak to the role of executive leadership?
I'm not sure I understand the question. Our executive leadership certainly is modeling the way. All of them, from the CEO to every single member, participates fully in standout and does their check-ins every week. They have wonderful stories to tell about how they use it in their everyday work. And they certainly talk about it with their teams. So I think it's important for the executive leaders to model the way. And we use the term team leader because whether you're a supervisor or a manager or a director or a vice president or a senior vice president, in Standout, you're a team leader and you have a team of people. And we want to be sure that you are connecting with those people, paying attention to those people, listening to those people, and certainly knowing and focusing and engaging them. So that's why I think the team leader title is appropriate.
And do you need weekly meetings with the team to sustain engagement?
I think you need weekly conversations with team members. You don't have to have a group meeting to make this happen. You can do, a lot of our nurses do get back to folks as they're rounding. Sometimes they, if there's something that they see in an engagement pulse, they may discuss it during a huddle. So they use the forms that they already have and they incorporate the Standout tools so it makes it simple for everyone.
Excellent. And that was the last question we have time for today. This concludes today's program. I want to thank Taylor and Amy for their excellent presentation and for participating. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you so much.